All right. Thank you for being here both in person and online. Tonight's talk is going to be what doctors know but don't talk about or don't show you about. So we're going to look at the system other than what we really take care of and understand why you get the care that you get and understand where they're coming from. And it's not like these people are bad people. It's just a different system. So with that being said, your medical practitioner, that would be like your DO or your MD, they have quite a bit different training. Their training is looking mainly at acute care. So their main training is about trauma. So it's like major injuries, falls, trips, car accidents, big injuries like that, infection. So we're going to be talking about like bacterias, viruses, parasites, surgeries, and pharmaceuticals. That's really what encompasses the Western medicine or the allopathic viewpoint. And when I say allopathic, I mean symptom treating viewpoint. What we need to be aware of is that chronic disease is not their wheelhouse. It's not what Western medicine thrives on. They're thriving, like I was saying, in trauma. So an example, if you have a gunshot wound, North America is one of the best places to go to the hospital because you're going to get saved really quickly. They know how to take care of that gunshot wound. The problem is after that, they've patched you together, taking care of you long term. That's where the ball is missed. Why is that happening? Because we're going to see that for chronic disease in medical schools, most medical practitioners have less than 20 hours on nutrition. So they're not taught a lot about how to actually teach people how to eat, drink, do different things because they're giving basic information. There is almost none or relatively none on things like stress management, stress, sleep, inflammation. So what do I talk about the most? Those things right there, because I'm on the other side. My specialty is basically chronic disease. That's what I see here. I'm not the guy who wants to see a shooting artery coming out or anything crazy going on. I'm the person that wants to help you get back in when we're dealing with a chronic long-term injury, chronic long-term affect. So when we look at this, what do we talk about? We chronically talk about inflammation. What are the drivers of inflammation that are being missed? And this is why when you talk to your allopathic provider and say, well, is this inflammation? They're going to go, sure, or I don't know, or really what's going on, because that's not where their drive is. Their drive is make symptom go away. Use the tools that we have. Does that make sense? So if we talk about inflammation, most people aren't aware that when you are emotionally stressed, that will actually drive inflammation. That will actually change your cytokines. It will change your red blood cell, well, mainly white blood cell counts. It will actually push them up just by being emotionally stressed. Yes, if you're exposed to chemical stresses, it will do it as well. Physical stresses as well. But emotional stress will literally change your white blood cell levels. And it will cause more inflammation. It will cause that to go up. So when I say inflammation, we're talking about white blood cell count. We're talking about the body actually causing inflammatory process to protect itself. And if we look at your practitioners, there's almost no training on neuroplastic changes and lifestyle. So the reason why you're not told the things that you're told here is because that's not what they're focusing on. They're focusing on acute trauma-based care. They're not focusing on chronic long-term diseases. Now, if we look at this, though, what are the things that are hurting our country is chronic long-term diseases. What are the two leading causes of death? Heart disease and cancer. And they are chronic lifestyle diseases. Drugs and surgery are not going to fix that. We need to understand that these are lifestyle diseases. So if we change our lifestyle, we can actually change the two leading causes of death, heart disease and cancer. So what is the underlying mechanism that's actually driving this? And it's kind of a chicken before the egg, but if we look at, say, insurance companies, and say, what are they going to reimburse for? That's what's going to drive the care when you go to a hospital or you go to a medical practitioner. And they're going to be charged and reimbursed for things like prescriptions, diagnosis, and things like surgery or treatments. So that's going to drive their cares. They are not going to be reimbursed at all for anything. Well, I can't say anything, for the majority of the things that take care of chronic disease functions. They are not going to reimburse a medical practitioner for nutrition. Well, if we go based on, I think it was Hippocrates, let food be your medicine and food be your cure, we got a problem, because if we're not being taught basic building blocks, we're not going to be able to understand what's going forward. The next thing is stress management. That is not in the wheelhouse, because stress management is a chronic disease issue. It is not an acute disease issue. So if you understand when you're talking to your practitioner that they're coming from acute make symptom go away state, then you understand that that's their whole job. It's not make me healthier, it's make symptom go away. Oh, my foot is shaking. Okay, let's give you a med that stops the nerve from being able to fire correctly. Now the shaking's gone, but there's more upstream effects that are going to happen. Then if you look at your reimbursement, there is no or hardly any reimbursement for brain training, for neuroplasticity driving. There's almost none for that. And then lifestyle, you may get a little bit, but it's not going to be the same for a surgery and a drug. So if we look at it, and you can look at different countries, the reimbursement in North America is based on intervention, not based on prevention. So if you go in a different model, and that's what I think is the biggest underlying issue, is that you can't change the issue if the model's broken. So the model is paid by what you do to somebody else. That's how you get money, instead of what you don't have to do to somebody else. An example, the Japanese, the doctors are given 10,000 people, and the more people that are staying healthy, they get bonuses. That's a different model. The healthier the people are that they take care of, they get bonuses. In our country, the more surgeries and the more prescriptions are done, they're given bonuses. So it's the reimbursement that drives the outcomes that we're seeing. So an example that really annoys me is if you look at pediatricians, they're reimbursed based on the number of vaccines they give to infants. That's their main cash flow. And it's really sad, because it's not about what's best, it's about what causes the money. So let's give an example of how this works. So let's say we go to a medical practitioner and you have a headache that won't go away. You'll be given a medication, doesn't go away. Now you get an MRI. There's nothing there, a stronger medication. But we haven't actually figured out what caused it. We don't go upstream. So if somebody comes into me and they have a headache, literally the first thing I'm going to say, and I don't even have to look at them, I go, drink more water. Because here in Colorado, everybody's dehydrated. Literally everybody's dehydrated. If your urine is yellow, you're dehydrated. Just drink more water. Just literally do that and tell me what happens. Just start with that. Are we hydrated? Then I got to look at major systems and are they working correctly? So I'm going to look at what's their stress, how inflamed are they, what's their diet. If we really want to go down diet and go into functional med and functionality, we go, are you eating foods that are actually causing allergic reactions that you don't even know? And the funny thing about this is the foods you usually crave are the ones that actually cause reactions. And I believe it's because when you get that reaction, you're going to get a mild dopamine rush. So I have a client and she loves eating French fries and loves eating potatoes, nochi. Guess what she's allergic to? White potatoes. So every single time she ate them, it caused more problems. The only way we can figure this out is we actually do an advanced antibody test to see if she has antibodies to the food protein. That is not in the wheelhouse of a normal MD. They're not looking at long-term inflammatory things. They're looking at, are you shot? Is a symptom there? Are we going to make it go away? That make sense? So that's what we're dealing with. So let's say normal protocol, headache, MRI, med. For me, I go, okay, headache, is it stress? Is it diet? Is it digestion? Is it blood flow? Is it blood sugar? Is it hormones? That's just off the top of my head. Those are all the things I have to look at. So I'll let you know when people come into the office, 90% of the time, what's causing the problem is one of these three things that I'm going to tell you right now. Oxygen to the brain, blood sugar, too high or too low, and stress, cortisol fluctuations. That's 90% of the time what it is, and that is not in the wheelhouse of a make symptom go away practitioner because that's long term, unless they're treating them specifically for diabetes. That's why when we look at the tests and I have people do blood sugar evaluations, we look at it and we go, okay, what range do we want you to be in for your blood sugar? We want it to be between 100 and 85. Oh, but the Freestyle Libre or the Lingo says 140 down to 50. That's called disease. That's not called health. Health is 85 to 100, and you spike and go right back down when you eat. That's health. That's adaptivity. That's being in the right state. When you say, oh, well, it can go up to 140. No, you're literally growing dysfunction when that happens. Anything over 100 is bad. Anything below 85 is bad. You're allowed to go after you eat above 100 and then drop right back down because your insulin response is normal, and then you stay in normal. But what else can we see? It goes up and then goes way too low. And you hear commonly, oh, well, that's fine. It's not below 50. You're not passing out. It's fine. It's insanity. Or I'll hear commonly, oh, your oxygen level's at 85. That's fine. I'm like, really? That's insanity. We want to be for brain health. We want to be at 97%. We'll see. I'll hear the craziest stuff ever, but that's because if it isn't directly correlated to the symptom person's coming in with, it's fine. It has no correlation with that symptom. But long term, it will. So understand that the major symptoms are just signals. They're just telling us there's a problem. There's an underlying issue that's going on. An example, pain tells you protection. So I have arm pain. That's telling you protect your arm because it's hurt. That's literally all it's telling you. Now, what's going on? It could be muscle issue. It could be infection. It could be lots of stuff. I don't know. Well, not until we do the history, but that's one of the indicators. Let's say we have anxiety. Why are we getting anxiety? We're trying to literally protect ourselves from something we think can hurt us. Pain is physical. Anxiety is external. So what is our body telling us? I have anxiety. I think something bad is going to happen. What if we have something? Let's see. Yeah, those are the two I was going to go over. What if we have something that's going on? And the bigger issue is that your practitioners know this, what the next thing I'm going to tell you, but they have no other tools. And what that comes down to is they know that if we shut down the problem, or the symptom, it doesn't actually fix the problem. I'll give you a prime example of this. And this one is so simple, yet so disgusting that it happens all the time. How many people do you know that are on stomach acid medications? A lot, right? I'm going to tell you the downstream effects of taking them. So you do not have indigestion because you have too much stomach acid. It's because you don't have enough. There's literally a feedback loop that happens. So if you don't have enough stomach acid, you can't break down the protein in your stomach. And what will happen is then it's too weak. And in the stomach, I drew this backwards, but so here's the stomach. And that's where all the acid is going to be. if you have this is how it's supposed to work. You eat, the vagus nerve says, make stomach acid, you make it, you break it all down, and then this chyme or very acidic food comes out, and then in the very beginning of the small intestine, there are receptor cells that say, oh, there's enough acid, boom, it relays back to the stomach, says shut off acid. So if you're acidic enough, the small intestine will actually tell your stomach to turn off acid production. If you're not acidic enough, it never gets that feedback loop. So you never get the chyme, or you never get enough acid into the digestive tract to actually turn it off. And now you keep producing acid at low grades. You're supposed to produce a lot and then almost none at all. That's what healthy is. So what happens? Oh, well, I have indigestion. That means you're not digesting your food because you don't have enough acid. So what's going to happen when you take that PPI or that thing that's protein pump that stops producing acid? Now you have even less stomach acid. Now, what does the stomach acid actually do for your body? The stomach acid tells your body or sets up the bacterial tract to actually grow the right bacteria. So if you're acid, if you have an acidic large and small intestine, good bacteria grow. If you have an alkaline, bad bacteria grow. What do bad bacteria cause? Cancer, leaky gut, the problems that we don't want to have, bloating, like all this stuff. So literally, if you have enough acid, it turns off and you won't get the problem. But if you don't have enough, you get all the issues. Then you don't have enough acid. The gut bacteria are wrong. Are you going to make the right micro neurotransmitters? No. So now you get anxiety, depression, all because you're taking in a digestive med because you have heartburn. Does it make sense? So we want enough stomach acid to make the right bacteria grow, to make everything work correctly. So the bigger question is, why are we not making enough stomach acid? When you're stressed out, you fatigue the vagus nerve. So you can be making less stomach acid because and you see this in movies, they talk about this all the time. The CEO that's really stressed out, pop in those Tums all the time because they're really stressed out. Well, the stress will inhibit the vagus nerve, the stress response, which makes you produce less stomach acid. So when you eat, you won't digest the food. So now you have food that isn't digestive. Now you don't have enough protein. Now you're going to get some forms of malnutrition. You're not going to have the cells be able to rebuild correctly. You're not going to be able to make those neurotransmitters. And it's all because of the emotional stress or cognitive stress shutting down the acid. So if we take the antacid, it'll make the symptom go away, but now it's going to lead to depression, anxiety, leaky gut, and that can eventually lead to immune issues and bigger problems that we don't want. That make sense? So it's, okay, you have indigestion issues. Let's make the stomach more acidic, and then the whole system will fix. Or we can give you a drug to make the symptom go away, but now we grow a bigger problem that will grow into from a little issue into a big issue that's very detrimental. So you can, so how can you? So that the question is, how do you produce more stomach acid? If your stomach is working correctly, you'll produce it. What we have to do is see if you have a bacterial infection now. Because what happens is, as soon as you have not enough stomach acid, you can get this bacterial infection called H. pylori, which will then inhibit you from producing even more acid. So we have to test to see if you have H. pylori to make sure that you did, because if you have enough acid, you kill the bacteria, H. pylori can't grow there. If you have low, then H. pylori happens. And you go, well, how do I know if I have H. pylori? If you have low stomach acid, and if you've ever eaten at a restaurant, you get H. pylori. H. pylori is in all the restaurants. Common, but it's killed if you have enough stomach acid. So if you have H. pylori, then we have to kill off the H. pylori, rebuild the membrane lining, and then make your stomach acidic enough to allow it to start remembering how to turn on and off neurologically. The problem is this is all driven by the vagus nerve. Now, what is the nerve I test on everybody? The vagus nerve. How do I test it? Do you gag when I touch your tongue or not? You have to jam way back and wiggle around. We got a vagus nerve issue. That means you potentially could have H. pylori, digestive issues, all this stuff. If I touch the middle of your tongue and you gag, I know it works correctly. So what we do is for those acid people is we make sure they have enough acid. The easy test I do is called an apple cider vinegar test. We take some apple cider vinegar. You tell me if it burns or not. No burn. We know the stomach's good. Now we can load it up on acid, and then we can get the cells to return back on, make sure the vagus is working, and it will literally start firing again. Because the body knows how to heal itself. It just needs to get back into the rhythm. If it burns, then we know you got H. pylori. We're going to treat you as if you do. If you want to spend money, you can do a breath test where they literally, you drink this sugar solution that tastes really bad, and then blow out within 10 minutes of it, and the gases that come out will tell you if you have H. pylori infection, because you'll produce different gases than if you didn't.
Is that drinking straight apple cider vinegar, or do you dilute it?
Yeah, straight apple cider vinegar. You take 2 tablespoons, and does it burn? Not your throat, but your stomach. Yeah, it'll burn your throat a little.
Like that.
Not your throat, but your stomach. Now, a cheat code, if you're like, oh, it burns, everything's falling apart, an easy way to help your body break that down if it's really bad is to take carbonated drinks. So like carbonated water will turn into a mild, what do you call it? Base. So it won't like hurt you, but it'll make you get the burps, and then that's the acid breaking down. So that's the acid in the acid and the base coming together, producing some gas as well as some water, and then you'll be okay. So that's an easy way. So if you're like, I get the worst and I don't want to take Tums, that's why if you take like club soda or like the new Perrier's or whatever, that'll work. But if you drink them routinely, it'll actually break down your stomach acid lining, and then you get sick. So people who drink that Perrier every day is actually not having enough because it's breaking down the stomach acid. It's like taking Tums every day. All right. So what is the missing link that Western medicine is not hitting? And it's the brain. The brain controls your hormones, how you feel pain, how your gut functions, how your immune system functions. But when you go to your medical practitioner, it's not how's your EEG, it's what's your blood. Now, don't get me wrong, blood shows you stuff, but you're never looking at brain health. We're not looking at how do we prevent dementia, Alzheimer's, how do we prevent decay, how do we keep your brain healthy? It's, are your labs normal? Yep, then you're good. Okay, how's my brain? I don't know. That's not my scope. That's not my scope. Send you to a neurologist. Do you have any symptoms? Nope. Then you're okay. Understand, they're not looking for function in health. They're looking at symptom. So the big thing that you want to do is when you do talk to your primary care provider, if it's a medical doctor, is you want to ask different questions. Say, okay, cool, doc. So I have indigestion. What's the root cause? What's actually causing this? I know you can give me this medication that'll make the symptom go away, but I know that's going to cause more issues. People call it side effects. It's not a side effect. It's a direct effect. You take it, it makes that problem happen. You stop taking it, that problem goes away. So what you want to look at is, what's the root cause, doc? Ask that question. Understand, my body's trying to protect itself, so what is it teaching me? Your body's not stupid. It knows what to do. It just needs to be helped. 99% of the time, it's protective mode, turn on your genetic predisposition, and then you show up with whatever you show up with. That makes sense? And then, what can I do to train my nerve system? Well, that's what we do here. That's why I love doing what we do. It's all about giving the nerve system energy, training the nerve system, helping the nerve system, rewiring the nerve system. That's what chiropractic is founded on. It's literally rewiring the brain, getting the brain healthy, and then you heal yourself. So for long-term health, it's brain health. For short-term keep me alive health, run to the hospital. And when you understand there are two systems, then you understand that when you come to somebody, an example, we have our new lady working for us, Sylvie, right? She can speak fluent Spanish. I have no clue what she's saying. So if I come and talk to her and she doesn't understand English, she doesn't know what I'm saying. So if I or you come and say, well, I'm doing this, this, and this, they go, that's nice. because you're speaking Spanish to somebody that only speaks English. That's not in their wheelhouse. That sounds nice, cool. And I'll give you an example of this. We had a teacher that I was in school, and he had thermal scans that he would do. And he said he had a patient who had terminal pancreatic cancer. She didn't know what to do. So she literally goes, I'm going to scour the world. She found out that there was, in China, you could go and you could have 4 monks pray over you. And she was wealthy enough that she goes, cool. So you guys have done this before and it actually gets rid of the cancer? And they go, yes. She goes, okay, I'm going to get a functional MRI and you're going to come in the room and we're going to scan me while you do this. And she actually had them all. And within 20 minutes, the tumor completely shrunk and went away. So she come back and goes, I have the cure for cancer. And they go, that's nice. We'll look at it when we find the cure. Because it's a different mindset. It's a different idea. It's a different way of speaking. It's chronic, not acute. When you understand that, then you're going to understand why you run into walls. Well, why can't? Because we're talking different languages. Once in a while, you'll see a doctor like Gupta or one of them that will kind of get into wellness, kind of get into chronic. And then all of a sudden they're talking, everybody loves them. But it's because they're starting to see the bigger picture. And that's what I'm trying to have you guys understand is understand you want to know what the root cause is. Not make my symptom go away, what's causing it. Know my body's healthy and say, what can I do to train my brain? If you do those questions, then you're going to be getting different outcomes. You're going to be getting better changes. Do you guys have any questions? So basically what I'm trying to show you is that we have 2 different paradigms, 2 different thought processes on how people look at the body. One is miraculous for acute trauma-based care. Don't get me wrong. That is where they live, but that's their lane. As soon as that acute-based care tries to infiltrate chronic, that's when problems start happening. Because the outcome for chronic, the acute is not going to work for the chronic. An example of this, I'll give you the example that I learned from one of my mentors, is that let's say my house is on fire. And you call the fire department. That's going to be your medical practitioner. They're going to come in and they're going to spray your house down with water. Those are drugs. And then they're going to cut down the door. That's surgery. And now the fire's out and your house is a shambles. Now, do you call them the next day and say, come and spray my house down every single day? No. But that's what using a drug chronically is for, because nobody asks, okay, I'm on it. How long should I be on it for? You want to ask, okay, I'm on it. How quickly till I can get off it? Yes, it's keeping me alive. My blood pressure is 200. Yeah, get on that med. Now, how do I get off it? Not I'm on this for life. That med is spraying your house down every single day. And they go, well, what's going on? Now I'm getting mold growing everywhere. I'm getting all these problems. Yeah, those are your side effects. What you want to do is you want to hire the carpenter or the electrician to come in and fix it. That's a chronic care person. That's me. It's really quick to rip stuff apart, but it takes a long time to put it back together. And that's the difference. So it's the mindset change. That's why it's hard for me when I have somebody come in who's in an allopathic mindset. They're like, well, fix it right now. You've been growing this for 30 years. You know, you don't just say grow flower and all of a sudden it's there. That's what we're running into is now we got to literally regrow it when you've literally broken it, cut it, shredded it all up. And so these are the different mindsets we're dealing with. And so when we understand that, then we understand the place and that you're not going to get the answer you want when you talk to the allopathic provider because they have to do it based on the 15-minute time frame of the visit and then what's going to be reimbursable. So I want to thank you guys for being here. I hope this helps you understand when you talk to your practitioners what they're going to be coming from and why they're going to be talking to you the way they do. Thank you. And my hope is that you can help your friends and family members understand this because they're like, well, why don't they talk about that? It's because that's not their lane. But you got a viral infection, that's their lane. You got a head injury, that's their lane to stop the bleeding. But then to fix it, you got to go somewhere else. Thank you guys for being here. Have a blessed night.
Okay.